Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers, and he is the Chief Medical Officer here at AFMC. Dr. Rodgers, thanks so much for joining us.
Oh, glad to be here.
So we're hearing more and more about THC use as laws and attitudes continue to change. Why is this an important conversation for healthcare providers who care for pregnant patients right now?
Yeah, I think probably the biggest concern about THC is its sort of legalization for sometimes recreational, but here at Arkansas for medical uses, and that we've just seen an overall kind of, increased use and kind of comfort with use. But particularly we've seen a big increase across the nation of use of THC or marijuana during pregnancy, which has kind of raised a big concern.
And from what you're saying, is THC use during pregnancy becoming more common, or what's driving the trend?
Yeah, definitely it's becoming more common. I think in the last 20 years, as you saw the legalization of marijuana across the country, we've seen that rate of use in pregnant women increase from 3% to about 14%, depending on how you look at the numbers. So at least maybe 1 in 10 pregnancies where mom is using some form of THC or marijuana, which is marijuana during the pregnancy. So it has been kind of this growing trend, especially as our public perceptions about medical marijuana have changed. And about marijuana in general, as far as its use, people have much more comfort. There's kind of less stigma associated with it. It's becoming, with edibles and vaping, there's other ways that people are sort of using marijuana, and it's just kind of grown generally more acceptable within our culture.
And when it comes to pregnancy, what do we know about how THC can affect fetal development or birth outcomes?
Right. Well, one of the things with legalization is that we do now know more than we did when it was illegal. Obviously, we knew that we didn't want to give pregnant mothers marijuana, but now that there is sort of this use for individuals who are pregnant or not pregnant, we do have more data. We have more information about marijuana's effects on developing brains. So the biggest concern is during pregnancy, where you have a developing baby that's not just, developing its brain, but also other parts of the body. And we know that marijuana affects all parts of the body. It's not just the brain, but it can affect your heart rate and your liver and other parts of your body. So we have more evidence about that. And we also know more and more about the effect of marijuana on teenagers and their developing brains, as well as just a general use in the population. So one of the things that it has allowed us to do is to collect more data on sort of that impact. And so we do know that marijuana does affect the baby during pregnancy.
And are there certain points during the pregnancy, patterns of use where the risks are greater?
Right. So it's sort of hard to know. It's kind of like if you think about smoking and alcohol use during pregnancy, which, back like with my mother, back in the days, there was less warning about the use of cigarette use and alcohol use, in which now you see sort of this general understanding that cigarette use and alcohol use during pregnancy is dangerous. But a lot of times with alcohol use, we used to say, well, maybe a glass might be safe, but now the general consensus, because of the effects of alcohol, is that no amount of alcohol is safe during pregnancy. And so we sort of feel like that about marijuana as well, not knowing when or where it could have the greatest impact. You generally sort of think about the earliest part of pregnancy when the baby is developing, and so it's doing a lot of developing and not just growing, as towards the end of the pregnancy probably is the area of greatest impact. But that also can be the time when a lot of people don't know that they're pregnant. So kind of measuring that impact and knowing that, but we do kind of generally say that any use of marijuana during pregnancy could be unsafe.
Some patients believe cannabis is a safer and more natural option for things like nausea or anxiety. How do you help patients and providers separate myths from what science actually shows?
Yeah. So with the adoption of medical marijuana, people do have this general idea that marijuana is medical, and so it should be safe. And where we do know that there are some medical benefits of marijuana for things like nausea and sometimes for temporary relief from depression or anxiety, we know that its long-term uses can be sort of detrimental, but it's more people use these, we get a better idea as sort of what that effect is. I think a lot of people also think of marijuana as sort of natural. It's a plant, and so that it must be safer. But we know that there's a lot of things that occur in the natural environment that aren't safe for people or for their developing, infants. So, I think that's where some of the kind of the general ideas that people think, oh, it's natural, it's a plant, it's medical, and sometimes all that information doesn't really give. I mean, there are still medications that we use for other medical things that are not safe for babies either. So, kind of getting good information about all that before considering its use.
And from a clinical perspective, what should providers be paying attention to when it comes to identifying THC during pregnancy?
Yeah, I think that definitely screening your patients for the use is kind of the best way, not necessarily trying to trap people into a urine drug screen, but asking them about use and kind of getting an idea. And even if they may or may not admit to using marijuana, just offering some kind of non-judgmental sort of good recommendations about the safety of not using marijuana during pregnancy, and providing the education that it can, potentially cause harm.
And if they do identify it, is that where their counseling, monitoring, or connecting patients to additional support comes in?
Yeah, and I think, so a lot of people sort of first adopt using marijuana to kind of help with things like depression, anxiety. It's readily available. You can, if you have those, you can get your card, and you can go to the dispensary and get some recommendations on what is sort of safe. But there are other medications that we have used for anxiety and depression that we know their safety profiles and that they are helpful. So I think number one, just telling someone to stop using marijuana I think that's an important component, but it's not always sort of an easy thing. So really finding out why they're using medical marijuana and why they might want to look at other alternatives or stop altogether. And then also providing the supports that they sort of need. And so sometimes 1 in 10 people will be addicted to marijuana. So providing, supports that they need to stop altogether. Maybe it's a referral to someone who has some expertise in this area of use of medical marijuana during pregnancy, or marijuana in general during pregnancy. And also, just providing that emotional support that people need. I mean, most of these people are using it to help because they're having a hard time with something, and it's helping alleviate those symptoms. So anything that we can be kind of supportive and trusting, and not necessarily, and I don't think that ever being accusatory or being punitive towards people is going to help. It's just going to kind of drive people away or not let them seek support. So I think, important to screen, to talk about its effects, to provide some alternatives, and then to make sure you follow through is to providing some supports to that mother, or their most essential things.
And where can healthcare providers find reliable, evidence-based resources to guide their conversations with patients?
There's a lot available now, to particularly looking at your professional organizations. The American Academy of Pediatrics and the American College of Gynecology and Obstetrics all have lots available on their websites about talking with pregnant mothers and nursing mothers about the use of marijuana. And it sort of approaches to helping address that, helping moms kind of decide that they need to make a change, providing supports that they need. And so there's some really good examples of ways to have that conversation, which can sometimes be difficult. There's lots of good resources there.
And you mentioned breastfeeding.
Mm-hmm.
So if they're smoking during pregnancy, they likely will continue.
Right.
Is it detrimental to the baby?
Yeah, it's possibly a lot more detrimental. So one thing we know about THC, the component of marijuana that sort of causes all the effects, is that it really likes fat. It gets stored in fat cells. So breast milk is made up of a lot of fat. So marijuana really likes the fat. In breast milk, it can get to very high concentrations. So whereas maybe in the placenta, the baby doesn't get as much exposure, they can get a lot of exposure through breast milk because that's where it likes to. So if a mom is going to decide to continue to use after pregnancy, definitely would discuss with her doctor alternatives such as formula to prevent exposure of the baby to that. Or if mom is able to stop use during breastfeeding, that would be strongly a recommendation. We usually say breast milk is best, but in that situation, it may be better to consider alternatives like formula.
Well, Dr. Rodgers, thank you so much for sharing the support and information.
Yeah.
Thanks for being here today.
Thank you.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.